Good morning. I'm Dr. Gaye Carlson, President of the American Academy of Child and Adolescent Psychiatry, with another of my Screenside chats for our AACAP members. For those of you who are tuning in for the first time, Screenside chats are meant to share timely clinical practice and other information from experts, mostly focused on COVID-19, but sometimes wandering to other topics. Reminiscent of President Roosevelt's fireside chats during the Great Depression and World War II, I'm hoping that the Screenside chats will fill a niche not otherwise occupied by materials otherwise available. Today, I'm pleased to have with us Dr. Melvin Oatis. Dr. Oatis is in private practice in Midtown Manhattan. He's a clinical supervisor at NYU Langone Medical Center, or I should say Child Study Center. He's AACAP's Assembly Chair of Delegates, and as such, he's one of the members of my executive committee. I've asked him to chair the presidential work group to promote health equity and combat racism, which are clearly a priority it should be a priority for our country in general, and it's certainly an important priority for us at AACAP. Co-chairing are with him on this committee are also Lisa Cullen and Tammy Benton. And together they'll oversee the numerous committees that we have at AACAP to further the cause of combating racism and evening out the healthcare inequities. So I'm going to ask him to start off with just summarizing for us what the Diversity and Culture Committee have developed as far as an action plan to further this cause. So Melvin, could you do that for us?
Yes, good morning, Gaye, and good morning, AACAP family. Thank you for this time to share. So the Diversity and Culture Committee has worked on an action plan that is quite comprehensive, it's malleable, and it's a working process. And not only does it involve just the Diversity and Culture Committee, it involves numerous committees throughout AACAP. And if you haven't been tapped already, stay tuned to your mailbox. You will be tapped soon. It has four main areas, one of awareness, one of advocacy, another of workforce and professional development, and also development of national partnerships. Under awareness, we've already started with giving Rob Grant and the Communications Department. They put out blasts, they recommend journal articles to our members, and we've had a number of members submit articles to AACAP News, which are useful, and they talk about various experiences with COVID and sometimes very personal ones. Another area is advocacy, which we're doing along with the Advocacy Committee and the AL Network, co-chaired by Deb Koss and Karen Pierce. This is a very wonderful component of AACAP, and it's going to allow everyone to find out ways in which they can advocate not only for their patients individually, but also locally with their legislators. So I should at this moment do a plug for Thursday, September 17th, when there's going to be a virtual advocacy training. So I invite you all to come to that because it's going to be very wonderful, and that's from 8 to 9:30 p.m. on Thursday. Continuing on, workforce development is very useful. Under that area, we have a number of programs that have been done. So the Healthcare Inequities Forum with all of the different caucuses, the Black Caucus, the Asian Caucus, the Latinx Caucus, the International Medical Graduate Caucus, along with the Native American Child Committee and the Rural Committee talked about healthcare inequities. So you can find that on our AACAP webpage. And finally, there's an area in terms of national partnerships that's going to stay in terms of development. So that's a work in progress. With this, there's a summer lecture series as well, where the training committee is going to present. The schools committee has already done a recording so that you can look at how can we even the playing field during this COVID pandemic. And also the Religion and Spirituality Committee will also be presenting as well. So all of these things are going to be resources that are available on the AACAP website.
So that's really a huge undertaking. And it's really impressive. Please realize you heard Melvin say you will be tapped. this is a lot to orchestrate, but we've really got some wonderful people in each of the committees who are going to be helping this initiative. Talk to me about something that's near and dear to my heart as president, but also I think is something that others of us out there, whether we're in another medical center or whether we're in a clinic setting, how do we go about finding leaders of color to help that equity situation? I mean, when we have something that we want to do, we want to try to be diverse. And it's not always easy. We end up tapping the same people. And so we need to grow more people. How do we do that?
Well, we started this, I should say the EC started this with a conversation. So AACAP is committed to this and having conversations at every level. And part of that is in terms of really developing and finding leaders of color and really diversifying our workforce is looking at our longstanding implicit bias. And that's one thing for us all to manage. And so we really have to look for opportunities where we can create discussions about why does the workforce look the way it does now, and then start to incorporate other viewpoints and bringing other people to the table to express why that is the problem. Then you really have to look at how do we then show an appreciation for the skill set that a diverse population brings to the table. Because if people don't feel welcome, they're not going to share their skill set, and they're not going to be open with their communication. So we really want to hear a number of people, but we also have to be not weary, but aware that we want to tap into that and that your opinion does matter.
I like to think of us maybe being baseball player scouts. I mean, you can tell I'm a great athlete here. I don't think they call themselves baseball player scouts, but you know, they go to the high school and they look and see who's out there playing ball, or colleges and see who's playing ball. They probably talk around, you know, any promising kids out there on the sand lot. Certainly this effort starts with getting people into medical school, getting people into training. I mean, you need to start growing people right from the get-go. But we have some good people in our membership. What do you suggest, Melvin? I mean, be practical here. Do we go around and kibitz on the committees? Do we send out a blast and say, please don't be shy. You don't have to be in a committee to call and be a part of that initiative? Give me some. You're talking to me now that has to do these things. What do I do?
Okay. Well, I say there are a couple things. First off is recognizing ambition in people. Typically, a lot of ways in which ambition is expressed in the West is like the me-centric kind of way, and there are people that do that. But I will say in other populations, the Asian culture, the Latinx culture, and somewhat in the Black culture as well, it's far more communal. There's a communal experience in terms of what was needed for survival. So oftentimes you may not have that person that steps up. So just as you said, kibitzing and asking people and letting people know that it is a priority and there's an awareness. So you have to create an awareness and allow people to know that it's there. And as I said before, we have to manage our sort of the biases that we have. These things are very important for us, for people to actually want to communicate. And so there are people that are there, recognize them, let them know that this is a priority, like you're doing today, like you've done many other times, and out sending out newsletters and talking about racism and talking about what's happening in the world, much like the things that we have to parallel with our patients, you're doing with the AACAP family, sort of letting them know that here's an opportunity in the midst of everything that's going on.
Well, I think it needs to be an active. I agree with you that it needs to be a culture. It needs to be something where, people say, yeah, this is my home. I'm welcome here. But I think we also have to be a little bit more proactive and That's the piece. And you know, it's frustrating, darn it, is this stupid virus. I mean, one of the things that I had really looked forward to doing as president is traveling around and meeting the people in various ROCAPs, giving talks. Yeah, I can give talks on screen and so forth, but it's not the same as being there, being among them. And that allows us an opportunity of seeing who's there and you know, maybe calling on people that might not otherwise have raised their hands. So I don't know what, I think it's going to just be extra challenging for the moment where we can't have that face-to-face thing.
I agree with that, Jay. And just as you said, like next year, hoping that we can actually go to Atlanta, there are a number of historically Black colleges and universities there that are quite diverse. There are student National Medical Association that are diverse as well. These are areas in where you have a number of people of various cultures and race that may be the future or are the future candidates in the leadership positions. And they have to know that they're welcome and really show you the steps to do that. So we are very quick to sort of validate a number of other institutions in different places. So we have to be mindful that we validate everyone in the other institutions that want to enter medicine and that they too have some talent to bring to the field.
Yeah, it's kind of good time. I mean, it wasn't planned, obviously, 5 years ago being in Atlanta next year, but that does seem a bit serendipitous, doesn't it?
It does.
So the other prong of the diversity and culture initiative is also the healthcare inequity part. If you ran the world, Melvin, what an amazing thought, right? If you ran the world, what would you do to help us level the playing field with the health care inequity piece? Maybe I shouldn't say if you ran the world, because clearly you don't, but what can you help us with as individual practitioners so that everybody at least has a little piece that they can do? You know, the expression about many hands make lighter work. I don't know if this is work necessarily, but it's like, it isn't an over there thing that somebody has to do. It's something that we all need to find a way to do it. Do you have any thoughts about what things you might suggest?
I love that comment. I love that comment. It's not an over there thing that someone has to do. So we start with what we've all been taught already in terms of a therapeutic alliance that we have with our patients. What does it take to build that? Start with that and expand upon it. We know that when we reach people, when we want to really connect with them, they have to be heard, they have to be seen. So when you connect with your patients so that they're not other, they're seen as a person that you will already know, a member of your family, an extended member of your family. Well, if you don't like your family so much, the family that you've grown and created
You can
for
choose
yourself.
your friends, but you can't choose your relatives.
Whatever you've created that you enjoy, that you have an affinity for, if you have that sort of connection to your patients, then you already enhance the communication. Once you've enhanced the communication, you've built trust. And then your patients are more apt to speak with you and really communicate what it is that they're feeling, what they're thinking. So you're establishing that therapeutic relationship. You're talking about what the core and essence of therapy looks like with your patients. And then you're inviting them to share with you because you're curious about them. You really start with a nature of curiosity and wanting to learn. And you seek that with your patients. But you seek that with every patient, not just the ones that look like you, the ones that don't look like you, so that they're not other. It's not over there. It's right here. It's in your office. It's right now. And as you begin to build that, you can start to build on working to correct the healthcare inequities.
We were talking the other day about the fact that people are more comfortable with people that are like them. You know, I'm happy with I know there are good male OBGYN people, but I'm somewhat happier with a woman OBGYN person, right? I think there are some data at this point that say that patients do better where they have a doctor or a healthcare practitioner who's of their same skin color or culture or whatever, that they've already got a leg up on the relationship bit, because there's the assumption that, well, if our skin color is the same, you at least have walked a little bit in my shoes. We've got a little something in common. So you're talking about making a relationship with your patients. You're obviously a Black man. And so I'm sure that when you have patients of color come in, they probably breathe a sigh of relief when they see you. They're not going to breathe a sigh of relief when they see me.
Well, that may be one way, but it may not be, because again, we're culturated the same, you and I, having been born in America, in terms of what does a physician look like, and perhaps physicians didn't look like you or I. For many people, physicians were white males or something else, but they weren't us. So it took a moment for people to understand that physicians look like many different people, and may look like them and they may not. But if we go back to people not being other and being just like us, and trying to make that communication or connection to them, we make a difference. So we're experts at being doctors. We may not be expert at the culture from which the patient comes from, but if we let them know that we care about that and teach us and help me to understand, for instance, in this pandemic and the racial injustice and things that are going on, racism isn't new. But oftentimes people weren't talking about this with their doctors. But if you as a doctor let them know, you're reading the headlines, these things are going on in the world. I'm curious as to how that might be affecting you and your family. Are you aware of that? Does it have any impact that you're aware of? Because maybe they haven't even thought of it as it affecting their health. But you opening that door, saying that you're concerned, that you're curious, and you as the expert know that this can have a detrimental effect to their health and well-being, you've scored a lot of points. You've really helped the situation. You've helped in equity right there, because you're looking at them like you look at other people that have been validated and that are valuable in this community. You've now done that to someone that may not feel that. You've gone a long way in approaching and really rectifying healthcare inequities in that one expression.
Can you think of a way of maybe having people expand their practice a little bit? You know, I'm of an age that I can be retired. I'm not, but I could be. And one of the things that I was thinking about, since I work a lot with the schools, is to say, you know, I don't have to be as concerned about whether I generate my salary or not. I would like to make available 2 hours a week to be available as a consultant to some of our school districts out here in Suffolk County, where you already know that the COVID penetrance is much higher than it is in other communities. And no big surprise, those are our Hispanic communities, our African-American communities, et cetera. Does something like that make any kind of dent in leveling the playing field in terms of healthcare, or is that kind of a drop in the bucket?
Oh, no, that's huge. Imagine if you do that and others do that, that is huge. Access to healthcare and the inequity, all of that is a problem, and it's not new, and it continues. So if you're saying someone doesn't have the access to actually speak to someone that is as well trained as you are, that has that season, that can really see and help them, imagine if the 9,000 of us, or as members, and maybe 8,000 are practicing. If everyone could donate an hour or two in different communities, what a difference that would make in terms of healthcare and equity. Or even if you're not donating the time, if you took your money and you placed it in areas where there are people that are working in those areas to help patients, that would also go a long way. So time and money in terms of your efforts is very valuable and does make a difference. It's not a drop in the bucket at all. I love that idea.
Talk to me about advocacy. I know you've been spending time with the advocacy committee, and the training session that they're going to be doing in a couple of nights is a couple of evenings is going to be I call it Advocacy 101. Tell me what you're hoping to accomplish on the advocacy front.
I'm really hoping that people are understanding that there are systems that are in place within AACAP in terms of a committee and a network that have you think about the ideas in a different way, a little broader. How do you really capitalize, codify that, and make it something that you can use and exert influence? In this instance, beyond just your clinical practice, how do you reach the legislator and let them know that these inequities exist and why what's out there already doesn't work? So how do you do that on a local level for yourself? How do you do it on a state level and hopefully on a national level? All of these things will be encapsulated in that training, and it's going to be active. There's going to be active learning. So not only are you going to have someone lecturing and talking about that, you're going to know how to find your senator, your House of Representative person in your local region, and how to tap into them and actually educate them on what the issues are in a way that they may not have heard beyond the headlines. They have a person, they have a one-to-one story to hear. That moves people, that moves laws, that makes a change in what we do. So it's about education there.
The lecture series, I know that I think it was Lisa was working on. What were the hopes as far as that's concerned? Whether there are some specific topics, I guess, that were covered for that. Do you remember off the top of your head what the issues were about why those particular lectures were selected?
Yes, they're addressing inequities, but I want to have everyone tune into this. If you're addressing inequities in certain populations, you're also finding tools to help all of your patients. All of your patients can benefit from having a doctor, but sometimes there are things that are specific about certain populations that we may have overlooked, or you're just not aware of it. So in some of these lecture series, that's highlighted along with all of the other things that you're already doing. So that's what's useful. So let's think about the schools committee. Right now, there's how do you send your kids back to school safely? And in certain areas where they're not going to open the schools, maybe not the public schools, the private schools might be open. So there you're advancing an inequity. Wasn't an intended consequence, but it's an unintended consequence when you're not opening. So how do you make education equitable for all? So that's some of the ways in which you're starting to think about this. If your kid doesn't go to a private school, they're in a public school, what do you need to do? Or how do you have the doctor help the family advocate for their kid on a local level to their school board in order to make a difference? So that's one way. And in the systems of care, it's like, how do we advance the systems of care to include everyone so that the systems work in a more equitable way? And as I'm thinking about this, you and I have had a conversation about when we're talking about diversity and equity and things of how that sounds to certain people. Like certain groups, they view that as a very moral, wonderful thing to do. And other groups may feel that you're favoring one group. And so I really invite people to understand that when we're talking about equity and we're talking about these things, is that other groups might require more because of systemic racism and things that have been underplayed for a very long time. And so we're beginning to highlight these things, examine and talk about them in a more open way. So that's one of the reasons why the summer lecture series is there.
You know, I think, and this is sort of a closing remark, and it's kind of a personal one, but I think what I have found more than anything is how much thoughtlessness there has been behind racism. And by thoughtlessness, I don't just mean you didn't open a door for me thoughtlessness. I mean that I think many people are good people. If they had thought about it, they wouldn't have made a certain decision, or they wouldn't have drawn a particular conclusion, or they wouldn't have said a particular thing. You just don't think about it. And so the thinking about it is important. The relationship piece is important, because if I mean, you and I have worked together pretty closely. If you say to me something like, Gaye, you could have put that a little bit better. I'm much less likely to take umbrage from you because I know you care, I know we share many similar values. I'm going to take that a little bit differently than somebody who I don't know who, might really be trying to be hurtful and nasty. So we do have I do agree with you about how important the relationship piece is. But then we also have to take risks in terms of making relationships with people and being honest and being able to step back and say, I didn't mean to be thoughtless. I really depend on you to educate me in these things. And then maybe we both learn something from that experience. Does that make sense?
It does. You're in my head right now because you're reminding me to talk about the resources that we have at AACAP. There's a whole resource page on our homepage about racism where you can look at that because it's not enough for us not to be racist. We have to be an anti-racist. And there are resources there, such as the book, How to Be an Anti-Racist, Me and White Supremacy, So You Want to Talk About Race. These are all titles of books that are quite great, that help to introduce the topic in a way that might help us to see our own blind spots in terms of that. So you're absolutely right in terms of being able to think about this in another way and have a framework. So those references really help.
Well, that's a good note to end on because you're plugging us, and there are good resources there that a lot of good people have worked on. So I think that on that note, this is obviously a process, and we're just beginning the journey, and it will take a number of different roads. And I'm hoping that, well, honestly, I didn't think Screenside Chats would be going this long, but I guess we'll go as long as we have COVID. We'll maybe do a follow-up conversation in 6 months or so and see how the initiative is progressing. So thank you very much, Melvin, for being with us today. Thank you very much for your leadership. I'm looking forward to the Advocacy 101 initiative on Thursday evening and the lecture series in general. And so thank you all to our viewers for paying attention. Goodbye.
Thank you.
Thank you all very much for tuning in. This is Gaye Carlson for AACAP's Screenside Chats.